So now let's start the second video. We understood the numbers. We understood our first step, that is ratio. Based on the ratio, if it is decreased, normal or increased, we fall into different branches. And in each branch, we're going to do different steps. We are talking about the branch of a normal or increased ratio. So you compare your ratio, you compare it to your predicted ratio, and I compare the actual to the predicted. What is happening? And then you compare the FVC actual to the predicted. What is your conclusion? Easy. So if we want to interpret this together, I first compare my ratio. First step is always ratio. My ratio was increased, which is why I fell into this branch. My next step is to look at F evens. Apparently you do have one of the exams that they did a minor change to your findings, and instead of no loss of weight, now they gave you a significant loss of weight. This just adds an extra layer of complexity to your case and a very typical multiple finding drama that you have loss of weight for cancers, you have smoking and sputum for COPD, you do have heart failure features. So now to that two list, you do also have a lung cancer added to the three things that you're bringing out of your, but because you have a condition called COPD, chronic obstructive pulmonary disease, and you do have narrow airways, this interferes with that normal gas exchange and leads to a higher amount of carbon dioxide in your blood that turns into an acid in your blood and creates this acidic environment. Overall, we call this a respiratory acidosis. So this is the explanation of your ABG. We'll keep it quite simple. Again, I know that it sparked a little bit of concerns and everyone, started worrying about things. But at the end of the day, it was a simple thing. It wouldn't be that challenging to interpret your ABG. One last thing that I might want to add is usually, because this question has been kind of brought up before, is to stop smoking. What is the cause of COPD? Mainly smoking. How do you prevent it from getting worse? Stop smoking. Almost all of the cases of COPD management that have been given to you in the exam, the patient has already stopped smoking. So as much as smoking is one very important key factor that we'll still remind ourselves of, in all of your cases, smoking has been stopped already. I think the reason that they tell you smoking has been stopped is smoking has its own big counseling, how to do smoking cessation, nicotine replacement therapy options, quit line and stuff like that. That might make the environment of this case a little bit challenging. This case has been designed to assess your knowledge of management of COPD, not the management of smoking cessation. Lifestyle modification will be helpful. So we want to tell the patient like regular physical activity for COPD will help. And this is the first time you will see pulled or a urinary antigen test for pneumococcal and Legionella. This is a complete good list of investigations for pneumonia. I just want you to avoid being that candidate who goes like, on investigation, I'll do full blood count, UEC, LFT, RFT, TFT, ESR, CRP, blood culture. Don't be that type of long list of irrelevant investigation. If you look at your handbook, there is one case that they give a prompt to the examiner that if you see the candidate just mentioning any investigation that they know, you want to mark them down because they don't know what they're talking about. So you always want to think about the relevance and memorize a good list of differentials. And again, I'll repeat myself for next year for the face-to-face exam. If they hand you the chest X-ray over here, that doesn't mean you're done with investigation. Finish your investigation list before you go to your next task. Now, in many cases, they used to give us an X-ray. Yeah, so the X-ray has happened on the screen in the online exam, and in the face-to-face exam, they usually give you a film or they hand you a printed chest X-ray. If we want to look at a few chest